Dr. Farrukh is a neurosurgeon trained by Johns Hopkins Hospital and has been in practice for over 30 years. Dr. Farrukh participated in bringing financial stability to the AV hospital, which allowed them to expand devices as they built a new women's and infants facilities and oncology building, and will be able to build a new emergency room. He urges all of our AV hospital employees, including nurses, to work together to enhance patient safety.
Antelope Valley Hospital has a rich history of serving the local Antelope Valley. Organized by members of the community, it opened in 1955. As a community hospital, it served all with a not-for-profit structure. The concept of a community hospital was to serve the entire community, not only those with money and insurance, but also the patients without insurance or the ability to pay for care. A board of directors, representatives of the community, was established to provide direction to the management of the hospital. The members of the board were chosen by the citizens of the Antelope Valley. In 1960, the hospital opened the emergency room. There was no full-time doctor on staff, so physicians from the community volunteered to work 24-hour shifts. The population of Lancaster was 26,012 people. In 1988, the current 5-story tower opened. At 5 stories, it was the tallest building in the valley. The capacity was increased to 260 beds, and the emergency room was updated. The population of Lancaster at that time was 118,000 people. By this time, there were 2 other hospitals serving the Antelope Valley, each with their own emergency room. Today, Antelope Valley Hospital serves a community of 700,000 people. They provide care to almost 20,000 patients a month. Under the leadership of the Board of Directors, Antelope Valley Hospital has achieved a number of nationally recognized milestones. Most recently, it was recognized by the federal government as a top performer on key quality measures. Less than 25% of hospitals in the United States achieve this award. As an accredited chest pain center and qualified STEMI or STEMI center, AV Hospital has won awards for the fastest times in treating heart attack patients. They do this with a dedicated team of nurses, technicians, and doctors available 24 hours a day. The Advanced Primary Stroke Center certification means that AV Hospital is capable of treating stroke patients quickly in order to prevent long-term disability or death. In fact, the hospital's record-breaking speed is 75% faster than most other hospitals. The Women's and Infants Facility is a special facility for women. The Women and Infants Facility is a special facility for women. It has its own building, its own nurses, doctors, and surgery suites. The facility is complete with a neonatal intensive care unit to treat very sick babies. It is staffed by board-certified neonatal intensive care doctors 24 hours a day. As the only maternity facility in the Antelope Valley, the Women's and Infants Center delivers over 100 babies every week.
You know, AV Hospital is unique. There's few hospitals in the country that have a women's and infant facility. And it's a hospital within a hospital. But this is a different kind of hospital. You have to have its own ambiance. It's a happy place where you make babies and bring new lives to the world. So it's a gentle kind of environment, dedicated for women, and we have their babies on the NICU next to them. It's clean, out of the place, the general hospital where you have infections, sick people. So it's a different environment. So I'm proud we were able to create such an environment for our community.
And it's not just babies. The hospital is one of the few hospitals designated as an emergency department approved pediatric center. This reflects the commitment to provide specialty care to children in the emergency room. It is virtually a hospital within the hospital, especially for kids. Cancer is a major health issue in the Antelope Valley.
So cancer is devastating. And for some reason, we have more patients or people with cancer in our community than anywhere else in the United States. And I'm proud that we're able to bring City of Hope and partner with them to help patients with cancer. And I believe we're able to deliver world-class treatment for patients with cancer today.
Antelope Valley's cancer treatment program is recognized by the Commission on Cancer as an accredited program. The technology includes the latest innovations in robotic surgery. Because of our geographic location and the distance to trauma-capable hospitals in Los Angeles, the need for a trauma center was evident. Dr. Abdullah Farrukh, a member of the board of directors of the hospital, pushed hard for the implementation of the trauma program, even though the cost of maintaining a round-the-clock team of trauma specialists was very high. In 2010, the trauma center was built into the existing emergency room.
The difference between life and death can be few seconds. And imagine the nearest trauma center is an hour drive away from here. So we developed the trauma program. And we have dedicated physicians, surgeons, and nurses 24/7 to save lives.
The almost 30-year-old emergency room is one of the busiest emergency rooms in the country. In fact, the emergency room treats over 10,000 patients every month.
We are one of the busiest emergency rooms in this country. And we do this in such a tiny space, where doctors and nurses don't have enough space to execute their job. Patients can be in the gurneys, sometimes in the hallways. It's clear we need a new, improved emergency room.
The doctors and their team of nurses and assistants are really rock stars, working in a facility that was built when Lancaster's population was under 100,000. This emergency room now serves a population of about 700,000 people.
You know, we've been trying to expand the emergency room in the Antelope Valley Hospital. And Antelope Valley Hospital is your hospital. It's a community hospital. And we take care of all the community members. A lot of our community members don't have funding to pay for their care. And they don't have insurance. And even insurance companies are not paying us what they should pay us, including Medicare. And that's why, for this reason, we've not been able to expand the emergency room at the Antelope Valley Hospital.
Please vote for Dr. Farrukh on November 8th.